Robby, what's on your radar?
Well, over the weekend, Buckingham Palace confirmed that Queen Elizabeth II had tested positive for COVID-19. The Queen is vaccinated, of course, but she's also 95 years old. So the news generated considerable public concern for her health. Nevertheless, in a statement, the palace said, quote, Her Majesty is experiencing mild cold-like symptoms, but expects to continue light duties at Windsor over the coming week. She will continue to receive medical attention and will follow all the appropriate guidelines. The Queen has the coronavirus, but is feeling well enough to continue light duties. That's terrific news. Here's a question I have. Forgive me for getting ahead of myself, but I expressed it on Twitter yesterday as well. If a 95-year-old woman can go on with her life per normal, despite COVID infection, what is the argument for continuing brutal restrictions on the least at-risk population of all, kids? Britain is thankfully opening up, as is much of Europe. French nightclubs have reopened. Germany has announced that March 20th will be Freedom Day, and on and on. Of course, many of these countries have never had rules on kids that were as strict as the U.S. rules. The World Health Organization, you will recall, does not recommend masking for kids under the age of 11, unlike our own CDC, which requires masks for everyone older than 2. The Queen of England, who has ruled for longer than most people have been alive, isn't afraid of COVID-19, but the bureaucrats who make the policies for U.S. school kids are so afraid of COVID that they think all students should be masked in the classroom forever, in the gym, in the cafeteria, in between bites of food. Why? For what reason? We know that kids are not particularly susceptible to coronavirus, whether vaccinated or not. They are the cohort that it should be easiest for us to let live their lives as normal. Yet in most places in the U.S., the strictest rules of all are the ones in schools. Relevant authorities, in particular the teachers' unions, are fighting to keep it that way. Even in places where masking restrictions are letting up, like in my city, Washington, D.C., the mask requirements are expected to remain within all schools. As I reported last week in leaked audio I obtained exclusively, the CDC has no plans to issue new guidance that permits COVID-cautious liberals to forego masks in schools. When pressed on this question by both Republicans and Democrats, Director Rochelle Walensky essentially took the view, well, she isn't obligated to change course because her guidance is just that, guidance. Now, many areas controlled by Team Blue take CDC guidance as essentially the word of God. Don't dare go against it, which means they could be waiting a very, very long time before kindergartners are allowed to demask. Some government figures associated with Team Blue want to move in the other direction, in the direction of greater restrictions. Last week, D.C.'s Mayor, Muriel Bowser, announced that vaccine and mask mandates were finally going away. Not entirely, not right away, not for everyone. The city's still going to mask school children all day, for some reason. You won't have to wear a mask in the gym anymore or show your vaccine card when you go to a restaurant. So that was according to Mayor Muriel Bowser's decision last week. Well, Bowser's tentative first steps down the road to actual freedom have still proven to be too hasty for other members of her government. Meet Brianna K. Nadeau, a D.C. City Council member representing Ward 1, who is, quote, so effing mad that D.C. is giving up on vaccines. This was her tweet the other day. Now, no one is giving up on vaccines, of course. The city is just no longer going to force waiters to check customers' medical records. And Nadeau's infant children are not threatened by other people's vaccination status. They could contract the virus whether or not the people around them are vaccinated, and they would likely have an extremely mild experience with the virus because of their young age. She is mad for no reason. There's nothing justifiable to scream about here. She continues that the lack of a vaccine mandate will scare people away from attending indoor restaurants. But of course, the mayor's owners stipulate that any establishment that wants to require proof of vaccination to enter is welcome to do so. And many are doing just that. DCist has provided a handy list. Now, there are a couple bars on that list that I have frequented in the past, and I will show my vaccine card if I go back when I'm asked to. Now, I likely won't specifically seek out those restaurants that don't. I will instead look for ones that don't ask my status, because even though I am vaccinated, I find it annoying, intrusive, distrustful, and of dubious social value. I don't really like when they ask my age or my immigration status or who I voted for or other personal information. Accepting that it's legitimate for the government to deputize private business owners and require them to be agents of law enforcement, force them to ask intrusive questions, is something we can't take back and are likely going to regret doing. Anyway, back to Nadeau. She is not content to let the COVID cautious and the over-COVID crowd go their separate ways. In fact, she has managed to call for a special legislative session last Friday in order to vote on her proposal to bring back the vaccine mandate. Nadeau, or Ultra Karen, as I am now calling her, I invite all of you to do so as well, is an enemy of choice. That's what it comes down to for all those COVID Karens. Our public health officials, our representatives, but also our fellow citizens and our neighbors. The American ethos is supposed to be live and let live. You decide what's right for you. I decide what's right for me. My philosophy accommodates you because you can choose a far more stringent COVID path if you want. But my philosophy doesn't accommodate you because you can't bend me to your will. Thankfully, Ultra Karen was defeated. She realized on Friday she did not have the votes to override a potential veto from the mayor, and she has given up trying to bring back the mandate. Quote, the executive has withdrawn this requirement when meaningful protection for children and people who are immunocompromised is just on the horizon, she wrote. In a few months, all of us will be able to receive an antiviral treatment that is 90% effective at preventing hospitalization and death, even if we can't get vaccinated or have weakened immune systems. In a few months, it is likely that our youngest children will finally be able to get vaccinated. That's true. The future does look brighter. Hopefully, in the next few months, we'll have even better tools for fighting COVID-19, better vaccines, therapeutics, etc. But our kids, who are not particularly vulnerable to the disease right now, have waited long enough. We've robbed them of enough time. Let's follow the Queen's lead and accept that COVID is no longer a reason for blind panic and authoritarianism. So, Ryan, I just thought it was hilarious, this juxtaposition. The Queen of England, someone who people have been fearful is going to pass away, will pass away at some point. Her husband died last year, I think. Very elder woman, has ruled England for like 70 years. She has COVID. We would have thought of this as a death sentence like a year and a half ago. Not anymore. That's great.
It'd just be a subplot in The Crown in one episode.
Just be one episode in The Crown. So if we're not really worried for her, it doesn't sound like there's any reason to be worried. She's continuing light duties. Why are these?
Well, what are her duties, though? Like sitting on the throne and
sitting on, bring me that peasant off with his head. I like to imagine her, ordering people to be executed or something. But I watched her. Did you watch her cutting? I should have played that little of her cutting the cake for her 70th. Did you see this? She's got a big knife. Maybe we'll put that in. She's got this big knife, and they're like, oh, cut the cake for your 70th Jubilee, whatever year it is. And she just kind of stabs it and goes, good enough. Yes. It's adorable.
Let the peasants finish
Let the peasants do it. Yes. It's adorable. Anyway, I know I talk about this a lot, and I return to this subject a lot, but it's still like they're still leaving the mask mandate for kids in place in the city in which we live. Yeah. Europe doesn't do this. Yeah, it doesn't make any sense.
We're down to something like 100 cases on a 7-day average, falling rapidly. So if it continues along this pace, we're looking at 75, 50, even lower in the weeks to come. And you've said it well before that if somebody came from outer space and looked around at the precautions that we're taking, they would assume that this hits 5 to 10-year-olds hardest.
Right.
When the complete opposite is the truth. When in fact, 5 to 10-year-olds have the least political power in our system.
Right.
And so are just told what to do. Followed shortly by surfers.
Surfers don't have enough power.
Right. Yeah, I mean, in that dynamic, certainly between customers and servers.
Yeah.
And also in the broader dynamic of our political economy.
Surfers.
Oh, no, surfers.
My mind was going, I'm like, what have I missed about
surfers don't have much political power either.
I guess they don't, but they're content.
I was thinking more of wait staff.
Got it. Right.
And the service industry people who are constantly being required to mask up while all the people around them are not.
This shadow behind the scene, the underclass of masked people, and so the 5-year-olds aren't necessarily vaccinated, and Queen Elizabeth is, but the statistics show that even unvaccinated children right now are at less risk than the vaccinated elderly.
95-year-old, right? That's right.
Right now. Right. So this whole we need to wait for children to be vaccinated, no, that's not scientific.
And the reason that they're having such a hard time approving the vaccine for children under 5 is that in order to counteract any side effects, even the mildest side effects, like a little sore throat or a fever for like an hour, in order to balance that out, you have to show some statistical benefit. Right. And if the disease is so mild to kids under 5 that they're not seeing any sickness, any significant sickness, then there isn't anything for it to mediate against.
Exactly right. It could turn out that the vaccine causes 5 myocarditis cases out of a gazillion among this, but they still go, that's a higher risk because there weren't even 5 serious outcomes in this. That is something along those lines is what they're struggling with.
And we don't know enough about the long-term effects of either the vaccine or the virus to be able to compare long-term effects.
Right.
But in the short-term effects, that's their problem. It's not necessarily that the vaccine is dangerous to these kids. It's that the disease is so not dangerous to them that vaccinating them against it.
Right.
It's like vaccinating against what?
If you have a kid that has some kind of is immunocompromised or has an underlying condition, that I think tilts the calculation very much in favor of definitely getting vaccinated.
Because then you have an actual risk that you're weighing against the benefit.
But we don't. The average kid just doesn't need to be at a mask all day. They just don't. So stupid. Frustrating. Well, I will continue to beat this drum until it's over. But I'm looking forward to your radar coming up next, Ryan.